Good morning. This is Dr. Beck. It is September 28th of 2021, and the Lord has blessed me with another day here to serve you and serve my community, and I am so grateful. And I want to reassure you that if you've got a problem and you need help, we're going to be here for you, okay? I promise. And give us a call if you need something so we can fulfill our promises to you. Okay, let's talk about some things. COVID-19, we hit the 2,000 mark today for total cases. And I've talking to hospital doctors or getting feedback from hospital doctors about some of the pending deaths or deaths that are happening in the community. And I've even had some happen in some other communities I'm affiliated with. And it seems to be the overwhelming abundance of people that are dying from COVID are unvaccinated. And I have been through the whole controversy with lots and lots of people. And I said this a couple of weeks ago, and this is one of the things that I keep going back to. If you are certain that you're going to get this disease, the side effect profile related to the disease is way, way, way higher than the vaccine. So what I'm trying to say is I understand that there is a risk associated with the vaccine. I don't think we know exactly what they are. I don't think they're tragic. I don't think they're ubiquitous. I don't think they're everywhere. I think there's isolated pockets of people that might have a reaction, but having it substantiated is not there. The flip side of that is, man, we know this COVID on an unvaccinated person who's at high risk, it can cause sniffles or it can kill you. And then there's a whole bunch of stuff in the middle that can happen to you, like debility, inability to work or to to even get up and walk across the room. I got people like that. So again, I think some people are going to die this week because they didn't have the vaccine. And I hear you, but don't pass it up, please. Okay, it's heartbreaking to hear about it. And even had one doctor who was, I guess, talking to patients about their feeling about the vaccine, and every single one of them said, "I wish I'd gotten the vaccine." So just an update on that, okay? Let's go on to the next thing. So yesterday I run a report based on the total amount of patients that I have versus how many patients got the annual wellness visit in the last year. And it looks like it's about 20%. Okay, so that means that there's a couple of thousand people that didn't get their wellness visit. Okay, I want you to get a wellness visit. The insurance company wants you to get a wellness visit. You prepay for the wellness visit. Okay, a lot of people don't understand this. You have insurance, you actually prepay for this thing. Okay, and I know that out of those couple of thousand people that didn't get your annual wellness visit, there's a percentage of those people, I don't know how many it is, where we would have saved their life. And man, it's hard for me to settle on that. In other words, am I missing opportunities to save people's lives? And I think I am if we're not getting enough of these annual wellness visits done. And I know they're paperwork, and a lot of people view them in different ways. Some people view it as government overreach or something like that. I don't see it that way. I see us setting aside some time to go through a checklist of diseases that could potentially kill you, matched up with treatments that could potentially stop you from dying. And all we need is to piece that together, and we can make a difference in people's lives, make a difference in your life. So I know that only doing 20% of these wellnesses, I'm missing some opportunities. And I hope it's not you. But I also want to offer you to say, look, if you need an annual wellness visit, you're a current patient here, you want or need an annual wellness visit, we will get you started on that. We'll do it for you, and we'll cover it. Just like I was talking the other day about the colorectal cancer. Like the colorectal cancer detection rate last year went down like 60%. So no, COVID does not cure colon cancer. These people, some people, missed an opportunity to catch their disease early, and some of those people are going to suffer tremendously because of that, and that's the kind of thing that I'm looking at. Okay, delay in a diagnosis from a screening exam ends at somebody's death, and because of the circumstances, we were not able to play it out the way we were supposed to and save their life. That's what I'm talking about. So, call us. Let's get you set up with annual wellness visit, please. And we can go through our checklist and make sure we've covered all the easy stuff for you. Okay. Again, I think it's going to make a difference in somebody's life. If everybody called right now, I would save a lot of people's lives. I don't know how many, but I just know that. There's not many people that can say, hey, if you do this today, you're going to get to live longer. So I'm privileged to be in that position, but I also need your help. Call us if you need an annual wellness visit. We'll get that taken care of. All right, last but not least, we had a great turnout last week for Place of Hope, North Georgia. The giving and the sharing of resources and funds is absolutely inspiring, humbling and inspiring. So I appreciate it, I really do. And I tried to personally thank every single person that was there because we're doing some good things, and I just, there's nothing negative about it except for the fact that poor kids have to be put into the system. But if we can't do nothing about that right now, but we can actually get them if we do and do something for them. All right, listen, it's been great talking to you today. I appreciate you listening. Have a wonderful day, and let us know if we can help you, okay?